Ultrasound scanning in early pregnancy helps in many ways than one to detect early pregnancy during the concerned trimesters of pregnancy. A lot of ultrasound measures focus on specialists' methodologies for the purposes of assessment, as well as detection of various anomalies, which go to prove the fact for the purposes of mitigating risks from the points of view of getting the best possible results. These scanning are essential for finding out the size of the baby, the gender of the baby. This should be kept as a secret from the point of view of medical science rules and regulations, as well as the process of development at each stage of its development. These developments can be diagnosed with microscopic miniaturization magnitude from the point of view of getting the desired results. Ultrasound scanning also can detect miscarriages as well as other such happenings, with the proper diagnosis, with an emphasis on various symptoms, as well as ingredients which can be given of various chemicals and organs, in the form of composition configuration, in the manner of fruitful result. This scanning is very important and beneficial for the mother and father as each other's spouses without losing the qualities of getting the best evaluations through. It can also detect intrauterine pregnancy, as well as various other symptoms, to cover the entire magnitude of results, which will be all-pervasive for the purposes of enabling accurate diagnosis. While understanding the early pregnancy symptoms, a lot of stages of pregnancy can be magnified, as well as a picture can emerge of a World Trade Center attack on the impact of ultrasound scans, which involve detection of various stages of pregnancy accurately, with predictions of %% correct judgment. You can also conduct such tests on your fetus, as well as the abdominal tract of your body, to bring about various test results for the purposes of taking care and caution of the well-being of the mother and child. You can also find detection of various cramps which get involved under such circumstances, and also advise the precautions which need to be taken for the purposes of getting the best results, which can substantiate the technological edge of this scanning. These tests also reveal nausea due to smoking or intake of food or perfume, or during the cooking process, which enable a proper mannerism of estimating detections at appropriate time for the purposes of arriving at appropriate results. It also has the capacity to reveal the possibility of various infections during such circumstances. This enables you to note down in a calendar various symptoms occurring during various trimesters without losing the importance of varieties of scanning technologies. To conclude, these ultrasound scanning in early pregnancy can also cover whether or not the importance of laparoscopic tests are important by giving minute details of various other symptoms, which converge at a point when such tests may also be considered important. In spite of its efficacy, it is the decision of a sonographer and the doctor to decide whether such administration of tests is important for these purposes. Varieties of such tests can be assimilated and administered for the purposes of getting the accuracy of results, which are important for the purposes of getting correct results, enabling impeccable diagnosis.